My name is Dr. James Perkins. I am a chiropractor and a naturopath, and I am an advanced certified matrix repatterning practitioner. So I would like to describe a little bit about the history and how it works, who can benefit from it, and how you can benefit from trauma release through matrix repatterning. Matrix repatterning was developed in Toronto, Canada by Dr. George Roth, DC, ND. It is the premier trauma release technique right now in the world. Dr. Droige, MD, wrote a book. He's a neurosurgeon and a brain surgeon. He wrote a book on how the brain heals, I believe is the name of the book. In his book, he describes matrix repatterning as the premier trauma release technique for BI, brain injury, concussive syndrome and post-concussive syndrome, and which always leads to PTSD, which is post-traumatic stress disorder, anxiety due to the inability to think, perform multitasking, etc. through brain injury. But matrix repatterning works on a myriad of problems. Hundreds of successful release of trauma throughout the body from injury has been performed in my office. I am advanced certified since 2003, and I am the only doctor in Michigan who performs matrix repatterning. The technique is absolutely miraculous. It is just unbelievably what it can do in 1 or 2 or even 3 visits to clear out serious injuries from auto accidents, slip and falls, traumatic injury through sports. So let's go ahead and let me explain a little bit about the history of matrix repatterning. Dr. George Roth wrote a book years ago. It's used by many chiropractic colleges called positional release therapy. He was also John Upledger's instructor in Florida through the craniosacral program for 3 years, and he's been a chiropractor in Canada for 30 years. He developed matrix repatterning out of positional release technique, and through that technique we have a wonderful opportunity to release tension in the body. In the early 1970s, it was still thought that the cell of the human body was sort of like a water balloon filled with molasses with a whole bunch of organelles inside of it moving around. The microscopes were not electronic at that time, and so we didn't have a lot of ability to look inside the cell deeply. Dr. Ingber of Harvard Medical School and Dr. Wang and his group that were cell biologists began to develop the electron microscope and tweak it and tweak it and tweak it until we finally got to a point where it was so powerful we could look right into the cell. So in the late 1970s, the electron microscope was able to give us a glimpse of the fact that the cell of the human body has actually a skeleton inside of it. Now this skeleton, if you could imagine what a Buckminster Fuller dome looks like, and if you don't know the term, you've seen them all over. They're triangles upon triangles upon triangles which create a dome. This dome has tensional integrity and structural tensegrity, which means it's flexible, but yet it has tension, so people can climb on it and walk on it, and you can do all kinds of fun things with a Bucky dome. You can make them big, you can make them small. You can make them huge, like amphitheaters, and you've seen these in Montreal when they had the expo there, which was in probably, I don't know, 1997, something like that, or 6. Anyway, the Buckminster Fuller dome is much the same tensegrity as the human cell. Inside the human cell, we have a structure that looks exactly like this child's toy. We have long protein struts, and they're held together with bungee cords, which are actin-myosin filaments. The name isn't important, but this is what it looks like. So it still has structural tensegrity, and it has structural support, but yet flexibility. So now everything makes sense. Inside this structure, we have stuck in these things the nucleus, the nucleoli, which are 3 of those. We also have the mitochondria and all the different organelles. We now understand why they're held this way and what happens. So Dr. Ingber in 1980 was able to go ahead and look right into the nucleus of the cell and actually see that as we have tension on this structure, the nucleus of the cell also pulls and elongates. He also decided to see what would happen if he went and injured the cell, like that. And what he found was when the cell is injured, it becomes extremely tight. So if you could picture a cell now, and you have something that looks like this, and you have another one that's smaller inside, and another smaller one inside of that, and then this is stuck inside bigger ones, and then you have bigger ones and bigger ones and bigger ones. What happens during trauma is simply this. This is a very similar concept. You have these triangle upon triangle structures. When the cell is injured, it does this. It sticks out like that. It radially expands, and it becomes caught, and it kind of twists a little bit, so it becomes distorted. Now the problem there is nothing will release that. Nothing will come along and release that unless it's deliberately done. So if you had an AccuScope or an OnDemand machine, or if you had cold laser, or if you had other devices, it works wonderfully for this, but you can also do it very simply with the energy coming out of the hand. So Dr. Roth developed a concept whereby all the practitioner has to learn is they have to learn exactly a way somehow of developing a accurate way of looking at the correct vector of release. So this cell will have a vector of release, and let's say that the vector is from the side. If I put my hand here and I put my hand over here, the energy will eventually release down, and the caught structure will release and become softened. So if we had a bottle like this little Fiji bottle here, oops, I advertised. Here we have a structure that was actually molded exactly the way someone wanted it to be molded, some rounded, some square. And this is very functional. It looks nice, and it's a demonstrator model, because what we're going to do is we're going to injure the cell. Now here we have an injured cell. And as you can see, there's a point here and there's a point up here, way up here. Well, we can visually see this. In the clinical setting, we use the barrier of the body as the matrix, as an indicator, and then we use our hand as a scanner, and we go around and we try to find out the exact same, or the exact correct vector of release. So in this case, obviously, if we'd be here and here, we would find this on the person. It could be on a shin, it could be on a foot, it could be on a spinous process or a vertebra, it could be in the cranial vault. Could be an occipital bone, or maybe a sphenoid bone, whatever that is. It could be partly the face, it could be a nasal septum. So what the practitioner then does is very simply get a nice little engagement of the hand on the vectors, and with very, very little energy, and it doesn't take very long, we have, for the most part, released the cell, so now it can go back to looking pretty much like what it did when it was first molded. The reason for that is there is a cellular memory in all cells that remembers exactly the shape, the size, and the function of itself at all times, even after it's injured. So now we know how matrix repatterning works. We know how it's used clinically and applied in the office, and we know the types of things that it can help with the most, and that is, beyond a doubt, trauma release. Last year I had the pleasure of working on a young lady, very pretty young girl, ready to go to college on a scholarship for lacrosse. She'd already had 2 concussions, and the one I was working on was her 3rd concussion. She took a lacrosse stick right to the face, and it just literally just molded her face into something not recognizable from the right to the left. Over a period of about 12 matrix repatternings, we were able to not only correct the TMJ problem, we corrected her oral cavity and her oral problem, because her mouth was down and her face was molded. We literally molded that face, and we released the tension in there, and she became just like she was prior to the post-concussive syndrome and the actual physical damage to her face. In Michigan, I don't know why men wear helmets when they play lacrosse. Women are not allowed to. This causes a big problem. I see in my office 3 or 4 serious cases of post-traumatic stress disorder due to the fact that these concussive forces causes these people to have very, very difficult time functioning. And in this girl's case, she lost her scholarship for lacrosse because she was very scared to get injured one more time. Her brain wasn't working very well. Her writing was kind of off. And it takes the brain 3 or 4 years to really recover from something like this. So it's important that she not play lacrosse, but it is important that she go to college and learn and still try to keep up. And I think she's going to do fantastic. So the idea here is trauma in your body will stay there. That dent in that Fiji bottle will sit there in that bottle in a landfill for about 500 years. And the reason for that is because Dr. Donald Ingber found, and in 1998 he wrote an article called The Architecture of Life, and he found that when he put anything organic underneath that electron microscope, it all had the same structure. Every single thing. Wood, clay, petroleum, which is what that bottle's made out of. Anything organic, any kind of plant material, plant cell, human cell, animal cell, everything has the architecture of life within it. It's fascinating, and it makes so much sense, and we've learned so much by this. I wanted to share it with you. I'm treating a guy right now with motorcycle accident because he, as soon as the helmet law was released from motorcycle riders in Michigan, he took his helmet off and he got into a serious auto accident with his motorcycle, and he had to have brain surgery. It's been 2 years now. He's finally recovered from having his skull put back on, and I'm doing matrix repatterning on his post-traumatic stress disorder, and it's working wonderfully for him. He is so happy. He sees such improvement. This is a young man, probably 32 years old, that couldn't walk 5 or 6 steps without falling. He's now bopping around doing well, so he sees a huge difference with it, and so do I. And it's just wonderful to see this. I think you should give me a call. I think we should sit and talk about this and see if maybe this would work for you. My number is 248-855-8707. That's West Bloomfield Alternative Health Solutions. Go on my website, my-alternativehealth.com, and learn more about matrix repatterning for yourself. Thank you very much.